Common cat eye problems and their descriptions. 1. Keratoconjunctivitis Sicca, dry eye. A condition where a cat cannot produce enough natural tears to keep the eye moisturized and functioning properly. 2. Conjunctivitis, pink eye. Inflammation of the pink membrane, conjunctiva, covering the inside of the eyeball and eyelids, often caused by viral or bacterial infections. 3. Blepharitis. Inflammation or infection of the eyelids, including muscles, connective tissue, and glands. Causes include allergies, congenital abnormalities, infections, tumors, and inflammatory disorders. 4. Stye. An infection of the sebaceous glands in the eyelid, appearing as a red, sore lump near the eyelid edge, resembling a pimple or boil. 5. Keratitis. Inflammation of the cornea, leading to symptoms like a cloudy or watery appearance of the eye. 6. Third eyelid protrusion. Visibility of the third eyelid may indicate underlying issues such as wounds, worms, diarrhea, or viral infections. 7. Watery eyes. Overproduction of tears or blocked tear ducts can cause matted or stained fur around the eyes, often signaling allergies or other medical conditions. Anatomy of a cat's eye. Conjunctiva, pink connective tissue attached to the eyelids and sclera. Sclera, the white part of the eye. Cornea, clear outer covering with 7 protective layers. Third eyelid, thin, viscous layer covering most of the outer eye. These descriptions provide a concise overview of common feline eye conditions and their key features. Comprehensive guide to cat eye infections. Causes of eye infections in cats. Viral infections, feline herpesvirus FHV1, is a common cause. Bacterial infections, often secondary to viruses or injuries. Corneal issues, ulcers, keratitis, or trauma. Genetic/breed predisposition, some breeds are more prone to eye problems. Environmental factors, irritants, chemicals, smoke, dust, foreign objects, or allergies. Kittens, higher risk due to weaker immune systems. Symptoms of feline eye infections. Pain/discomfort, rubbing, scratching, or squinting. Redness/swelling, affecting eyelids, conjunctiva, or third eyelid. Discharge, watery eyes, crusty buildup, or pus. Light sensitivity, excessive blinking or avoiding bright light. Stuck eyelids, due to dry discharge. Veterinary diagnosis and testing. Serologic analysis, identifies underlying causes, viral, bacterial, fungal. Fluorescein eye stain, detects corneal ulcers. Culture/specimens, for bacterial or fungal infections. Blood/urine tests, checks for systemic issues e.g., FIV. Treatment options. Antibiotics, ointments/drops for bacterial infections. Antiviral medications, for herpesvirus-related infections. Antifungals, if a fungal infection is present. Supportive care, warm compresses, Elizabethan collars, and natural supplements. Home care and recovery tips. White heavy checkmark cleanliness, disinfect toys, bedding, and food bowls. White heavy checkmark warm compress, reduces swelling and discomfort. White heavy checkmark Elizabethan collar. Prevents scratching/rubbing. White heavy checkmark monitor other pets, prevent spread of contagious. Crossmark avoid self-treatment, never use human medications without vet approval. Key takeaways. Early detection and vet care are crucial. Treatment depends on the cause, viral, bacterial, or fungal. Hygiene and supportive care aid recovery. Chronic conditions e.g., FHV1, may require lifelong management. If your cat shows symptoms, consult a veterinarian promptly for proper diagnosis and treatment.